Welcome, everybody. Today we are talking about how to give an awesome grand rounds. This can be for grand rounds or any general presentation. Hi, my name is Randi Sokol, MD, MPH, Master of Medical Education. I'm here today to teach us a better way to give a grand rounds, one that relies less on PowerPoints, and very detailed presentations, and more on helping your audience leave with a few meaningful take-home points that can be applied in everyday practice. I have begun this presentation with a PowerPoint to point out we do not need to read a PowerPoint to help others learn. How ridiculous is this? And since you can read faster than me talking, there are two competing input systems, and I'm just confusing your brain. It might make me feel more ready if I have these words to fall back on, but I don't need them. This presentation will be better if I take the words out. Okay, so let's get started with our learning objectives. The learning objectives are to use Gagné's 9 events of instruction as an organizing framework for your Grand Rounds presentation. Create a focused Grand Rounds presentation with a few clear and succinct learning objectives that meet learners' needs, and implement various techniques for creating interactive learning sessions that play to the different ways people learn. So, to start off, I want you all to think about some kind of presentation, a grand rounds, a lecture that you went to that was just fabulous. You left saying, oh, that was so great. And then there was probably a flip side, one that wasn't so great. And I want you to think what made them so great and what made them not so great. So I'm going to give you a minute to write this down. If you have a piece of paper, draw a line, put the good things on one side and the not so great things on the other side. So this is your time to think about that and write that down. Go for it. Okay, so hopefully you've gotten some ideas down on paper. If I was doing this live, I would ask people to share what made it great, what made it not so great. And so we would be opening this up right now to an interactive discussion. However, we can't do that. So I'm going to share with you some things that others have shared with me in the past. What made it so great? People have said that the content was applicable and we can actually use it in practice. The content focused on what learners need to know, not what the speaker wants to talk about. There were opportunities to practice so we can check if we learned. It was very interactive and it kept our attention. It involved stories that are concrete and memorable. It was not boring and it kept to a very few simple points repeated over and over so we got the message. What made it not so great? People were talking at us for long periods of time, telling us things that are not applicable. When people tell us so much and it's information overload, and we walk away not being able to use any of it. When people just read from their slides, and when we don't know what we are supposed to be getting from the presentation. So you're probably tuning into this right now because you're thinking how you want to lead a particular grand rounds or lecture that you have coming up. So I want you to keep these points in mind throughout what people really care about when they come to see a presentation. So the overall framework that I'm hoping to provide for you today to help you structure your upcoming presentation is something called Gagné's 9 instructional events. So I put here the 9 instructional events, but I also want you to recognize that you have accompanying this presentation, there is a blank sheet that has the Gagné's 9 instructional events on it. There's a blank one and there's one with an example. And then you also have a checklist for the things you should check off before you're giving your grand rounds. So all this is going to help us frame what we need to do when we're designing our presentation. So if you forget everything, you can go back to these handouts and to the checklist. So again, Gagné's 9 instructional events is a framework. It really helps people create intentional and well-structured presentations that have been shown in the medical education world to really help learners learn. We will go through each of these 9 events. So how does it start? It starts by gaining learners' attention. How might you do this? So again, if I was talking to you live, I would ask people for their ideas. You would be shouting out lots of different ideas to me right now. Some of the things that you might shout out are, we can start with a story, something that's very memorable that grabs the learner, gets them interested in what you're talking about. Maybe a case, something that was very fascinating or that was important for some reason. Or maybe a video. Again, you're trying to grab the learner and make them want to engage in the information. Maybe you can tell them this is going to be on your boards, depending who your audience is. So let me ask you this. What did I start with? How did I gain your attention? You probably remember I started with me reading a slide, and I was making the point that we shouldn't be reading slides. So hopefully you're like, that sounds intriguing. I can't wait to learn more from this presentation. That's the goal. It was ridiculous. Yep, the point was hopefully being made. The next part of Gagné's 9 instructional events is to develop 2 to 4 learning objectives. Notice that it's 2 to 4. It's not like 5 or 6 or 7. We want to focus on a few things that learners can really take away. The question you're really trying to address is, what do you want your learners to be able to know by the end of the session? Now, sometimes we can put together a presentation and the learning objectives can become kind of an afterthought. Oh, that's right. I got to write learning objectives. But I would argue that if you're really trying to do a intentional presentation with very concrete focus, then creating your learning objectives at the beginning will really help you focus your presentation. You probably have the experience in the past of starting to work on a presentation and you start doing all this reading. You're like, oh, that sounds good. Maybe I should add that. And this sounds good. Maybe I should add that. Before you know, the presentation there's a lot of stuff there, and you might lose track of the initial intention of the presentation. So narrowing your learning objectives and actually including less is actually going to be more for your audience. Kind of a rule of thumb is if you're debating whether to put something in your presentation, 9 times out of 10, you should probably not put it in. Again, you want to keep it narrowed and focused. One way of doing this is using Bloom's taxonomy, which is a way of identifying what your learning objectives are, focusing on the verbs. You can see here at the very bottom of Bloom's taxonomy pyramid, there are lower order thinking skills. So in this situation, your learners are just going to be able to do minimal things. These are still important, but things like listing things or describing things or explaining things. As you move up into higher order thinking, you're really asking that the learners are going to be able to do a higher level of things like applying the information or creating something from the information. I would say that to get to these higher levels is going to change what you're putting in your presentation. For example, if you want people to apply something, then you're going to have to give them the opportunity to apply it. That means you need cases or scenarios where they actually have to engage with you and do something to show that they understand the information, not just list or describe it. If you want them to create something, then your presentation is really going to have to help them be able to create at the end, which again is going to change the content of what you're putting in and how you're engaging your learners. So let's look at the learning objectives I said for this presentation. Look at the verbs here. I said you're going to use Gagné's 9 events. If I say use, and I say you're going to create a focused grand rounds, and you're going to implement various techniques. So these verbs are actually pretty high up on Bloom's taxonomy. So hopefully by the end of the session, you're going to feel that you can do these things and have done them. You're going to apply things as we go through this presentation. I will also say it's totally fine to do a presentation where learners are not using or applying. If you want to keep it to a lower level of like thought process of just listing, explaining, describing, for example, that's fine too. You just have to figure out what are your goals for the presentation. Where do you want your learners to be at the end? If you want more information about Bloom's taxonomy, I put a link here. I learned a lot about this when I was doing a master's in medical education. It was really helpful for me in guiding my presentations. So let's do an example. I promise you this presentation is going to be very meta. We're going to be doing a lot of the things we're talking about. So let's imagine you are creating a grand rounds on CHF, right? Now, there are tons of things you could talk about. So many things on here. We might have the tendency to want to do all these. Oh my gosh, I got to cover epi. I got to cover signs and physical exam findings. I got to cover the stages, the pharmacotherapy, the role of diet, so many things. However, I would also argue that this is going to be way too much information. If we try to accomplish all of this, our learners are going to walk away and feel there's too many things. I don't know what to take away. So more sound approach to this would be to choose one of these. This might be a different framework for you, but to choose one of these and really dive deep into that. So let's say that we decide we're just going to talk about pharmacotherapy of congestive heart failure. Again, we are trying to take less stuff and dive deeper into it. That's the goal here. And then another goal is to, when you have a very concrete focus and you're going to dive deep in, you're going to tell them what you're going to tell them, which is the learning objectives. You're going to tell them, and then you are going to then you're going to tell them the information, and then you're going to tell them what you've told them at the end with a nice recap. The idea is to keep going over things over and over. So by the end of the time, you've repeated things and it's really sunk in. So they've had a really in-depth discussion of one topic without having very superficial discussions of a lot of different things and left with not necessarily much information. The other thing to keep in mind is that when we are wanting to give a lot of information, if we feel like we need to give more, or we want to give them something we don't have time to talk about, we can also refer them for further reading if they need it. So if we were to use this as an example, congestive heart failure, and we're trying to write 2 to 4 learning objectives that focus on specifically the pharmacological management, what might we write down? Thinking about the verbs and what we want our learners to get out of this. So going back to this pyramid right here, and we're thinking about heart failure. I want you to let's just take a minute and try to write a few learning objectives about the pharmacological management of heart failure. What would you want learners to be able to get out of that presentation? So I will give you a minute to try to come up with a few learning objectives. Just take a stab at it. Okay, so if I were doing this in person again or live, I would say, who has some examples? Let's share some of these examples. It would be interactive. People would be sharing their ideas. But in the interest of a webinar, I will share some possibilities with you. So maybe the goals are to describe the benefits of goal-directed medical therapy for the treatment of heart failure with reduced EF. Maybe it's to explain how to start each of the 4 medications in the inpatient setting, or manage complications of these medications and titration, specifically around AKI, hypotension, electrolyte abnormalities. So this would be a very concrete, very focused presentation around these medications and what our goals are. Now look at the verbs here: describe, explain, manage. Now if you think back to Bloom's taxonomy, where are those? A lot of these are at the bottom. So we want our learners to basically just be able to, get enough out of the presentation to maybe, list some of the medications, describe how they work, describe some of their side effects, how they interact, what we need to be monitoring for. However, there's also a manage here. So if I use the word manage, that means the learners actually need to do it. So there needs to be a component to this presentation where they get to do it. I'll get to that later on, but what you're going to hear me say a lot is cases are key. Giving learners opportunity to look at a case, not just read it and then you tell them the answer, but a case where they sit there, they talk through it, they think about the possibilities, and then they get feedback on what and how they're thinking about things. Again, we're going to go over this soon in the future, but cases are key to really having learners apply things. Okay. Number 3 in Gagné's 9 instructional events is we want to stimulate the recall of prior knowledge. When a learner is sitting down to engage in information, they need to pull up in their brain what they already know about it. Their brain needs to be activated in a way to be like, okay, this is what I know about the subject. Now you're going to build off it and help my mind grow. So that's how the learners, that's why it's important for the learners. And for you, you need to recall, have them stimulate their prior knowledge so you get a sense of where they're at and how might you grow that. So how did I do this? How did I get you all to pull up what you prior knowledge about the topic of giving a grand rounds? What did I do? I had you sit there and think about, well, what do I like about it? What do I not like about it? So now your brain is primed and you're ready to engage in expanding the knowledge even further. That's what we did. We made a list. How might you do this for heart failure? So let's go back to our example. Right now, I'm having you apply information that we're learning in this session. How might you have somebody recall prior knowledge for heart failure? So again, take 30 seconds and write this one down. Okay, at this point, again, I would turn to the audience, you all, and ask you, how might you stimulate recall of prior knowledge? Some possible examples are maybe you can poll the audience with a quiz at the beginning. Ask some key questions about your topic and see where your learners are at. Or you can just ask the audience questions directly, such as, what are 4 categories of the goal-directed medical therapy meds? Let's see where you're at with that. Do we know the 4 categories? Why is this so important for our patients? Why are we even talking about this to begin with? So you get people thinking about stuff, you get to hear what they already know, and then you're building off it. Okay, the next part of Gagné's 9 instructional events is presenting the content. This is where the information comes in. You're directly giving them the information they want to know, focusing a lot on less. Now, there's kind of a rule of thumb that after 20 minutes, people's minds just gloss over. When STFM told me to do this, they only gave me 30 minutes. And I know some other program directors that only allow their faculty to teach for 20-minute increments. Now, you might be like, wow, that's just not possible. But what I would argue is trying to minimize the amount of time you're actually presenting content. Believe it or not, the best presentations are the content is minimized and the application of the content is maximized. Whenever I do reflection sessions with the residents I teach, I often ask them for positives and deltas at the end of the presentation. And they usually say to me, Randi, we really like the information. We really like the cases that you did. We want even more cases. So I've gotten to the point over the years where I just give them a ton of time to practice. There's questions, there's answers, there's time for discussion. And whenever I do that, they really appreciate the sessions. So we can present content, but we need to give people the opportunity to use it. So as we're presenting the content, how do we do this? Sometimes we can rely on PowerPoint. And as I hopefully illustrated at the beginning, PowerPoint is not always the best way to do this. Can it be useful? Certainly. But a lot of things we can just say, and we don't need to put words on a slide and read from them. We can put up graphs or pictures or other ways of portraying things. Again, I would argue that instead of putting things on PowerPoint, we can have speaker notes. So probably psychologically for ourselves, why do we use PowerPoint? Why do you think it's easiest to use PowerPoint? So I'm asking you a question in your brain to help you recall what most people would say about this, but it feels secure, right? We can just read from the slides. We don't have to worry if we're nervous or we forget, or the slides are prompted, right? So if you are worried about that and you want to avoid PowerPoint, one way around that is to write really rigorous speaker notes. That means you've gone through the slides, you've written out what you want to say, and you can rely on those if you need them, but you're not directly reading from a screen. I will say this takes a lot of work. When you develop a presentation to literally write out everything you're going to say ahead of time and fine tune it, it's really helpful, but it does take a lot of work. However, your learners will probably really appreciate you not reading directly from your slides. So that being said, the goal is to keep it as interactive as possible. How can we do that? And at this point, I would probably say, audience, how can we keep things interactive as I'm trying to keep it interactive with you? You can ask the audience questions and have them give you feedback. You can do cases with answers, which is what I was talking about. You can do a group quiz where people vote on things and then you talk about it. Ask the audience questions, what I just did to you. I like this one too. Using the audience, inviting them to share their experiences and what they've learned previously. No matter how many times I give a lecture on a topic, there's always somebody who knows something a little bit nuanced or different than me. And I love to invite people to share that. Sometimes I'll be talking to my residents and I'll say, well, has anybody learned anything else or have a different way of approaching this? Or how might you explain this to a patient? And this is also a nice strategy if you have different learners with different levels of learning in the room. Sometimes I have third-year residents, and sometimes I have first-year and second-year residents. So when I ask the audience, sometimes the third years will actually share information that's helpful for the interns. So it's a good way to invite people to engage and also to teach each other, and we're all learning from each other. We can do role play or fishbowl. I really like fishbowl. It's a nice way where basically sometimes I pretend to be a patient or have somebody pretending to be a patient. And then the fishbowl is everybody else around is kind of like the shared doctor. And they are, if we're learning like how to communicate something with a patient, then the shared doctors get to practice communication skills and they're all doing it together. So one person is not necessarily put on the spot. And it's a team effort of using like a doctor brain together. And then when you do that model, I'm able to stop it as it goes and give feedback about the communication skills. So people really like learning because they can see how other people communicate about things and everybody gets feedback in the process. We can also do peer-to-peer sharing. If you're having a discussion about something philosophical, or maybe it requires two people to really think about things, you can turn to your partner and discuss a question. Another way to keep it interactive. And then different teams can report out. Small group discussions. Yes, that's the last one. Small group discussions and reporting out to a larger group. Okay, the next step in Gagné's is providing learner guidance. What does this mean? I'm looking at my time clock right now and I'm realizing I need to move because I want to keep this, I want to keep the time appropriate for your brain so you don't get too much information. So I'm going to go faster, but providing learner guidance is a structure to your overall presentation. This might be challenging. How can you link all the information together in a way that the learner can just take the information in one big structure and have a framework or a general approach for the topic? So, what framework am I providing you to structure your grand rounds? Note that I'm asking you to apply the information I'm giving you. What framework am I providing you? I'm giving you Gagné's 9 events. You have this framework for designing your grand rounds. And I gave you a structured checklist so that when you leave here, you have this overall framework that you can go back to. What framework could you provide for a CHF lecture? That's a challenging one. I'll share what I provided when I taught this to my residents. I created one big model that shows how to think about the medications based on evidence, based on patient's ejection fraction. So I divided it into reduced DF, preserved DF, mildly reduced DF, and improved DF. And then I grouped all the medications together with the latest evidence so that residents could look at this and have an overall framework of how they might address CHF based on meds. This took a lot of time and I had to really conglomerate all the information together, but this is one way of organizing it into an overall framework. Okay, the last steps of Gagné is the part that I was alluding to, which is so important that we often don't do enough, which is actually getting our learners to use the information. And then when they're using the information, we have to give them feedback. Well, did you do this correctly? Did you think about it correctly? Are there other ways that you could have thought about it so that they know if they're applying the information in the correct way? So why do you think we don't dedicate enough time for practicing, for actually doing it? I will say we'll sit in a lot of lectures and we'll sit there the whole time and somebody's talking at us. We never get the opportunity to use the information. And probably one of the reasons is because there's not it takes a lot of work for the person such as me or the person giving the lecture to come up with ways of practicing, right? So I will, and if I'm doing a lecture that the residents really like or my co-faculty really like, I probably spent more time coming up with the cases and the answer key to the cases than I actually did the whole lecture. I spent a ton of time putting the information together, but then turning it into cases that are applicable, it requires you to really understand the information and to spend time writing cases and answers or other ways to engage the audience. So it takes a lot of work. So think about how have you, even though we're doing a webinar, I've been trying to get you to practice some of this stuff. How have you been practicing today? Well, you had to identify what made a good presentation. You came up with your list. You told me how to gain people's attention. You had to write learning objectives, and you had to identify how to provide some guidance. So we have done some application. It would have probably felt a little more real if we were doing it live. Finally, this is not really part of Gagné's 9 instructional events, but these are other hot tips for giving an awesome grand rounds. Prepare. So you should have gone through the presentation and said the words aloud at least one time before actually giving it. Saying the words and actually using all the words you're going to say in the presentation is really helpful. So that, yes, you can stumble along things like what I'm doing right now, perfect example, while you're doing the presentation. But if you've said it at least once, you know where you're heading with it, and you'll feel much more comfortable. Arrive early. There's probably a lot of preparation, and you don't want to feel all flustered going into your presentation. And then, and I would argue, I actually add this on, this is my Gagné's 10th instructional event, is that we should be allowing at least 5 minutes for questions. Now, a lot of times we end our lecture at 8:59 and 59 seconds and then we say, any questions when people have to leave at 9. Why do we do that? A lot of times people don't know how to handle questions. So it's really nice when we feel like we don't have to. Here are a few strategies if you're worried about handling questions you don't know the answer to, which is always common and happens a lot. You can just literally say, oh, I don't know, but I'll get back to you on that. Or you can ask others, hey, what do others think? Does anyone here have a strategy for this question? Or the politician version of this is block and bridge. That's a good question. It reminds me of something else I do know the answer to. So you could try any of these strategies, but questions are a very rich time for people to learn things and to take things away. So having at least 5 minutes for questions is good for your learners. These are a few other pearls I put together that are not related to Gagné's 9 events, but I think is very important. And these are things that I try to do with all my lectures, especially when I have time, because they do require a lot of effort. One is considering pre-work, some degree of a flipped classroom approach where your learners do something before they come into the session. I like to send out things for people to read or just like a one-pager for people to look at. Maybe they can listen to an audio session or complete a module. With my residents, I teach the addiction curriculum, and one thing I do is we actually have structured time where they have dedicated an hour time where they can listen to an audio or watch a module, and then after that they come and talk to me, but they have time on their own to think about things at their own pace and go through it in their own way. And then when they come into the lecture with me, I kind of reflect, what did you learn? What did you take away? And then I get a sense of where they're at. And then I build off that based on, teaching additional pearls. And then we do a lot of application. And every time I do this, I accompany things with a one-pager summary sheet. Because I don't know about you, but you can sit in a great lecture and soak a lot up. But then you leave and 3 weeks later, 10 weeks later, you come upon a patient with that exact thing. You're like, I wish I remembered that. So sending your learners a one-page summary or developing a dot phrase for your electronic health record can help people use the information at the time when they actually need it. Again, a lot of work, but very helpful. And then I like to provide cases, which I've said about 1,000 times. I like to provide an optional, this is optional, you can provide follow-up reading or activities if people want to dive deeper, and then always ending with an assessment so you can learn and grow. What did people take away from this? Any questions, reflections? I love hearing what people learned. It's really helpful for me. And then I also offer, what was good about the session? What did you like? What could I do differently next time? That has taught me how to be better and better and keep improving my teaching by actually asking people at the end. It doesn't take much time. Sometimes we're hesitant to do it and sometimes we forget, but what did you like? What could be better? Okay, so from here, what do? You have Gagné's 9 events as blank sample and you have a checklist. This is what your checklist looks like. So when you're preparing your grand rounds, you can remind yourself what you need to do. It tells you you need to identify 2 to 4 learning objectives, use Gagné's 9 instructional events. You're saying, yep, I did it. For each item in Gagné, you allocated how much time you're going to spend on each section. Less than 20 minutes to talk to your audience. Hopefully check that off. More than 15 minutes to let them practice things and go over the answers. At least 5 minutes at the end for questions. During the talk, you minimize the use of PowerPoint. You relied more on your speaker notes than slides. You focused more on less, and you avoided the need to be comprehensive. And if there was more info, then you gave them supplemental. If there's more info they wanted to know, you gave them supplemental information to read afterwards. You kept the session interactive. You use stories and anecdotes to convey the information. You were repetitive. I feel like this has been repetitive. And you practiced and got feedback before you actually gave it. Okay, so I'm going to conclude with what we've talked about this whole time. And yes, this is me telling what I've already told you guys a bunch. So the reviewing everything we learned today, what I want you to leave with is your goals are to gain learners' attention through stories, cases, and videos. Choose learning objectives and stick to them and to stay on track and focused. Write your verbs intentionally. Do you want to just be able to know something or really apply the information? Because that dictates what you're going to do the rest of the hour. Stimulate recall of prior knowledge. Present the information, the content. So you want to use Gagné's 9 steps. You want to budget time, keep it to 20 minutes, focus more on less, keep it interactive, repeating, minimize use of PowerPoints. Oh my goodness, I feel so repetitive right now. You want to provide learner guidance. Remember, I provided you Gagné and a checklist, and you want to give people the opportunity to actually use the information and get feedback from it. So if I were doing this live, I would say, what questions do people have? I would give you enough. I would give you at least 5 minutes, and I'd be okay if I didn't know the answer. And if this were not a webinar, I would also ask you, okay, what are people taking away? What did you learn? Any reflections? Anything surprise you? What did you like about it? What did you not like about it? And then I would use that for the next time I gave this presentation. The end.